GM everyone, and thank you so much for tuning in to the inaugural bio.xyz demo day for Cohort 1. My name is Benji, and I'm a contributor to bio.xyz, and I'll be your MC for today. We're excited to take you on a journey into the weeds of DeSci as we explore some of the most exciting biotech DAOs coming out of the space. Here's what you can expect from today. First, we'll get an overview of bio.xyz by Vincent. Then, Laura will take you through the massive opportunities within women's health and the promise of Athena DAO to disrupt this massive industry. Albert will then educate us on synthetic biology and how Valley DAO can fill in many of the funding and collaboration gaps that exist for synthetic biologists with novel IP structuring. After that, Andrews will take us through Hair DAO, a thriving community of hair loss fanatics trying to break through the false hope and failed promises to make the world a hairier place once and for all. Chris will then expand our minds about how SciDAO can democratize research of this powerful yet misunderstood class of mental therapeutics. Finally, Demo Day will come to an end by CryoDAO showing us how our lives don't have to end too. After that, we encourage you to dive into the Discord servers of each of the DAOs, where the communities will be waiting to answer any questions you have in a live Q&A. If you stay till the end of the presentations, there will be a POAP for everyone still on the live stream, so stick around.
Thank you, Benji, for kicking us off. My name is Vincent Weiser, and I'm one of the leads of bio.xyz. I personally, when I saw my grandmother go through dementia, became very disillusioned by the medical system, and then later discovered longevity research and saw it as a potential to solve those age-related diseases such as dementia, and got really excited by the potential of it, but also was struggling to figure out how to contribute to this field with more of a crypto background and building in DeFi. So I realized with these mechanisms like DAOs that they could potentially be used to also solve and advance scientific problems and potentially solve diseases such as age-related diseases, which then later in 2021 culminated in us creating BioDAO, which is a longevity research DAO focused on solving age-related diseases, and ultimately attracted a lot of different builders, some of which also are presenting their own BioDAO today in a specific therapeutic area that they are excited about. So let me screen share my presentation about bio.xyz. So bio.xyz is our launchpad for BioDAOs. The goal is really to take our lessons that we learned from building VitaDAO to other therapeutic areas. We support not only with a $100,000 mission-aligned grant, but also really with these frameworks and different aspects that we figured out on VitaDAO, and also with a community of successful biotech DAO operators, co-initiators, researchers, scientists, technologists that help you make your BioDAO a success. Those kind of services range from branding and design, where we help make a BioDAO look amazing, to regulatory feedback and support on the governance frameworks on the operational side, as well as on awareness and community building, on the research working group and setting up the deal flow processes, as well as tokenomics, incentives, fundraising, and the different crypto parts of your DAO, and the technical IP NFT integrations, which is a new primitive that we engineered at Molecule to bring science on chain and make it liquid and tradable and transferable, and a new DeFi primitive. So I already briefly mentioned VitaDAO, which is the first and leading biotech DAO that we created in 21, and which attracted a lot of community members and funding, and we funded now over 15 research projects in less than 2 years of existence, and looked at over 300 or 400 deals, and are still very actively funding research and advancing longevity research and incubating biotech startups as well. And I was personally also really positively surprised to see the traction we got with VitaDAO. So we had Pfizer join us half a year ago as very established, of course, pharmaceutical player, which I honestly didn't expect when we started out that this would happen so quickly. So I'm really excited by this cohort of BioDAOs. So we kicked off in September, and in such a short time span, like, these DAOs made really inspiring progress. A lot of them funded their first research and have amazing research projects in their pipeline. And I'm excited to hear from them today. But also remember, the first cohort comes to an end, and the next cohort will kick off in the summer. So if you want to create your own BioDAO, you can join our bio.xyz Discord and apply for creating your own BioDAO. But also, don't hesitate to ask us questions how to create your BioDAO. So I'm really excited to hear now from Athena DAO and Laura. So take it away, Laura.
This is about you. You, and especially you. You and all other beautiful women. Because you are built differently. Literally. Women have unique health needs and experiences that require specific attention and study. Yet biopharma's investment in women's specific conditions are just 1% of their total spending. And the medical sciences continue to underfund studies focused on women, even among diseases that affect women most of all. Athena DAO is giving women an opportunity to act and be part of the decision-making and funding the scientific breakthroughs that impact their lives. Let's change the landscape of women's health research. To learn more, go to athenadao.co.
And how are we going to change the landscape in women's health research? I'm going to tell you about that. My name is Ramin Kini, and I'm the core lead of Athena DAO. I started my career in luxury and fashion, worked with companies like LVMH, Apple, and Amazon. And though I learned how to sell things to people that they don't necessarily need, I want to spend the rest of my years selling something that every woman needs, better women's health research. So I'm going to tell you about our vision at Athena DAO. Athena DAO is a decentralized transformative community working on women's health research, education, and funding. What is our vision? It is to be the leading community-driven platform enabling translational women's health research. We believe that with more R&D, there'll be more clinical data, which will lead to better investments, which will lead to more therapeutics, and ultimately for new treatments and options for women. And why is this important? Well, we're just simply leaving half the world's population behind. We have not done the scientific research that we need to when it comes to women's health. There is a data gap, a funding gap, which has led to a massive market gap. And I want you to think of this number. Only 1% of the budget in R&D and biopharma goes to female-specific conditions. When you think that half of the population are women, it just does not make sense. In biotech and decentralized science, we hear a lot about the value of death. Well, when it comes to women's health research, we're a long way off. We still need to do a lot of discovery and fundamental research, which we think it's a massive opportunity. Our solution is a decentralized community to fund, govern, and incubate translational research into women's health. Our collaborative global network allows us to source projects all around the world, working with Web3 and blockchain technology and incentives, which drives all of this. And we are a global female-led collective. It's very important that we drive the point that we're focused on incentives that benefit women. We also think that our mission is crucial to bring more women into Web3. The advantages of the DAO model are huge. They present a unique opportunity for people that are driven by a mission to come together and work towards pushing that mission forward. Researchers, blockchain technologists, community of women and patients and funders working together to drive one mission. And here is women's health research. I already told you about myself, but I have an amazing team with me in the core. We have Inés Santos Silva, who's been working in entrepreneurship and innovation with governments in Europe and in Portugal. Dr. Maria Marinova, who specialized in ovarian aging and now is a venture analyst at Apollo Health Ventures, and Dr. Stefano Pinilla, who is an expert in pharmacology. We also count with amazing contributors that are bringing their expertise and their years in either academia, industry or Web3 to the table to drive this forward. Our supporters can, as well as institutional support from academia, great research institutions, and Web3 companies. So how do we make this happen or keep the DAO going? We're starting first with the ROI from early stage research assets, IP, data NFTs. We're also already experimenting with our NFT memberships for community access. And in later stages, there'll be equity ROI from biotech access, as well as proprietary products developed within the DAO, such as the clinical trials platform and data platform. Women's health research is so overlooked and such a great place to tackle the issue of finding better outcomes. The other thing is that when it comes to women's health, it's vast. So we're focusing on the areas that are most underfunded to start with. Our first round of submissions was ovarian aging, and we're going to be doing next in the summer endometriosis and polycystic ovary syndrome. The way that we do things at Athena DAO is very focused and targeted per cohort of condition. This way we can do a comparative analysis within the research project submitted and make the best decisions. We're very proud that we already had amazing submissions for this first cohort, about 50 projects, of which 10 were selected, of which 6 made it to the top. These 6 projects started terms negotiations as well as in senior review, and we are incredibly proud to have Dr. Mario Cordero be our first project. We have exclusive licensing rights and it's ready to fund. The other thing that is crucial to understand is that to us, the proof of concept of how this is so needed is the fact that we had amazing institutions from Cambridge to Harvard submit to us, as well as researchers such as Dr. Charles Brenner, who's a well-known name. It means that people in the field of women's health do need more funding and do need to have mechanisms such as ours existing. The most important and interesting part of all of this is that we can empower a new generation of researchers. Take, for example, Lu Dong, who's a PhD candidate at the National University of Singapore. She would not be getting this funding until she was a post-PhD and potentially with more citations, even though she's already been published in Nature Cell. We're very proud to have one of our contributors have submitted and be potentially one of our first IP NFTs as well. Athena DAO was formed in August 2022, but we already have a lot of traction. We were selected as the part of the bio.xyz cohort, already presented at an academic conference, and had our first Gatecoin grant, which allowed us to publish our very first public good or reproductive health report. We count with hundreds of community members, have great traction in social media, and have already provided a lot of value with our speaker series and educational talks. So where are we heading? It's going to be a crazy next 6 months. We have our Genesis NFT membership for the original supporter of women's health. We'll be minting our first IP NFT around that time as well. And then after that, we're going to be onboarding our strategic partners. And more importantly, we'll be working on our governance framework. We believe there's so much to do when it comes to how to make the decisions in women's health. This will be completed by the end of the year, which will lead to our token launch. So where are we going in all of this in the long-term vision? People talk about Bell Labs and Biotech, but I'm going to talk about OpenAI because we are where they were 7 years ago. And maybe we could potentially get there faster because when it comes to women's health research, there's just so much to do. And the fact that we have all this intellectual capital within the DAO could lead to having the most comprehensive education and resource hub, a women's health data platform, or obviously company incubation and formation. If you want to be part of our future of women's health, please join our community. And I want to take the opportunity to thank the bio.xyz team for being the first to say yes to women's health. It's been great working with them, and I can wait to work even more to bring more DAOs into the future, as well as more opportunity to women's health. If you are motivated to be part of our community or want to learn more about Athena DAO, please book a time. Let's talk. And though the Genesis NFT membership is for community members, I think that we also have to allow people that are really motivated to push this forward to join. So we also welcome you to fill out this form. If we have, as it's a very rare edition, if we have the space, we'll be glad to have you. Thank you so much, and hope to see you in our community to push women's health research forward.
Thanks so much, Laura, and hope that got everyone as excited about AthenaDAO as we are. Did you know that the Food and Agriculture Organization estimates the global food production needs to increase by 70% by 2050 to feed the growing population? Of course you did, but thought it would be good to remind you, because this is one of the many challenges synthetic biology hopes to face head on. Synthetic biology is not just a promising field of research, it is an inevitability. As nature evolves systems for manufacturing many of the things that we use day to day much better than we can with current technology. Synthetic biology looks at the genome as a computer program designed by natural selection, ready to be read, understood, edited, and upgraded into new versions that solve many of our human needs. The applications are big, and the impact is even bigger. Next up, we have Albert, who will explain the promise of synthetic biology to solve some of the world's most challenging problems and how BioDAO is the optimal organizational structure to add fuel to this exploding industry.
Thank you for that amazing presentation, Benji. I'm Albert. I'm one of the core members of BioDAO, and I'm super excited to be presenting our organization to you today. We believe in leveraging biology to improve the world around us. And we do this by bringing together the best researchers, entrepreneurs, and builders to collectively fund and translate synthetic biology. One of the most prominent researchers in the field, George Church, once said that everything we can manufacture without biology, we will be able to manufacture with biology. If you really think about it, it makes sense. Everything around us, from our desks that we're sitting on, that we're sitting by right now, is made out of wood. Our clothes, our foods, our medicine is all organic material, and biology can build that with atomic precision, completely sustainable without using petrol-derived chemicals. Synthetic biology enables all of this by using cells from plants, yeasts, bacteria, modifying those cells through genetic engineering and have them produce things like fuels, foods, materials, and medicine. And these cells use building blocks like CO2, waste, biomass, and sugar, and converts those into final products. Earlier this month, we invited many of the pioneers in the space to Montenegro to showcase synthetic biology to the blockchain world. We even managed to get Vitalik Buterin to join us. He was fascinated by the ability for microorganisms to manufacture cement without releasing CO2 into the atmosphere. We also invited LanzaTech, a publicly traded company that can turn CO2 into clothes, jet fuels, and fragrances. And he was gifted their most recent carbon neutral hoodie. He was really happy about it. Synbio allows us to create self-replicating building blocks. A group of researchers managed to create bricks out of cyanobacteria that would self-replicate every time you would divide them. So imagine introducing this kind of material in our manufacturing stack that we have today. We have all of this amazing technology, but what is stopping us from becoming the status quo of, what is stopping synthetic biology of becoming the status quo in manufacturing? And why are people like Greta Thunberg not really talking about it? Because we're not doing a good enough job to bring these innovations to the market. There exist system-level problems in how synthetic biology is brought to the market. At every stage of the technology development, we've identified 3 problems: the inefficient funding system, the lack of translational know-how for bringing these innovations to the market, and also the siloed and very hyper-competitive industry. Researchers have a hard time in raising capital. It takes them around 6 to 12 months to raise capital, and usually from very biased research organizations that fund very incremental research that doesn't have this moonshot potential. We believe research funding should be quite like startup funding. It's fast and it has the potential to cause a paradigm shift in the industry. The researchers that manages to get funding also have a hard time in translating their research into real-world applications. The problem is the limited know-how for how to do so. Researchers are not well versed in business development, and they're not fortunate to be located in major synbio hubs like San Francisco or Boston. And many of the times they have a hard time finding the right people that would take on the responsibility of the C team to bridge this gap. And the researchers who manage to bridge their technologies to the industry usually face a very competitive industry that not only places extreme emphasis on overprotection of IP, but also relies on partnerships for successful commercialization. And if you don't really have a big network, it can be really tough to find those right partnerships. BioDAO was started to bring together those that recognize these problems, to come together, solve them, and essentially establish a new way for translating synbio innovations. And this is all operated through a DAO structure. This model decreases the barrier to entry and allow anyone to come in and start contributing in a meaningful cause, and being rewarded for doing so at the same time. It allows funding to be allocated much faster, and the community can be involved in de-risking the research to ensure that the capital allocation is much more efficient and ensures that the research actually becomes something that is translatable. All of the IP that is generated through the system is also governed collectively by the community members, allowing IP to be shared in a much more fairer and meaningful way, because more people essentially have a say in how the intellectual property is managed. We're working with some of the leading synbio universities and institutions in the US, Europe, and Asia, and one of them being Imperial College London and NASA. And we'll be drastically expanding this pipeline in the coming 6 months. Our first project to be funded is with Imperial College London. I'm really excited about this project because it allows us to produce palm oils locally anywhere in the world without having to ship it and grow it in palm oil plantations. This project was sourced by the community, de-risked by the community, and it will generate a wide range of intellectual property that we've already started seeing commercial interest of by Zate Biosciences and Sempra, two startups that are working in this field. And why they're interested is because it can decrease their manufacturing costs by up to 70%. We're also working with Denmark's Technical University. What's different about this project is these researchers already had IP, but they had very little know-how for translating this intellectual property and also how to do so. This project, once again, was sourced by the community, is now being incubated by the community, and we've helped them in recruiting a C team, a senior advisory board, and now they're applying to one of the biggest biotech incubators in Denmark called the Bio Institute. The third project that we're really excited about has the potential to revolutionize computational tools that enable synthetic biology. Once again, project was sourced by the community, incubated by the community. We helped them recruit the team that they needed, helped them in the business development, and now they're raising at a 10 million valuation and recently applied to Y Combinator. Like many other BioDAOs, BioDAO operates using this flywheel model, where essentially all of the proceeds and equity that is generated through the DAO's activities, aka the research projects that funds and the IP that commercializes, circles back into the treasury to continue support more and more research. And with each iteration, the ecosystem grows, the IP portfolio grows, and you can start doing really interesting things with the revenues, such as building out the community's own lab infrastructure, which would allow BioDAO to start conducting its own research independent of universities. We're a team of scientists, entrepreneurs, and systems thinkers who believe in the power of collaboration and decentralization. Our diverse backgrounds enable us to approach the challenges of the synbio industry with a fresh perspective and a strong foundation in both the scientific research and business development. We're accompanied with an amazing community with deep research and industry expertise. And we recently partnered up with True Ventures, who will be leading our current round. True Ventures is one of the few venture capital firms working at the intersection of crypto and synthetic biology. And we believe they will be an amazing value add given their wide skill sets, their wide networks, and their community of entrepreneurs. If you're personally interested in being part of this round, we're currently hosting a Gnosis auction that anyone can get whitelisted to and contribute with funds to receive your growth tokens. This one will close on the 29th of April, and I believe this is in 24 hours approximately. I want to thank you for listening in. I hope you're as excited about the future as we are about synthetic biology and the impact that it can have on climate. If you want to continue this conversation, we invite you to our Discord to learn more about us, the team, the community, and the projects that we're currently hosting in the ecosystem. All right. Thank you so much, Benji, for hosting. Thank you to the whole bio.xyz team. And thank you, the listener who've tuned in today to listen to all of our pitches. Once again, I invite you to our Discord. I think somebody will drop a link in the chat. You can easily access it there, and we'll take it from there. Thank you.
Thanks, Albert, for that inspiring presentation. Next up, we have a group that I'm ashamed to say I didn't take seriously at first. Though the team has a great sense of humor, it has become very clear to me that hair loss is no joke and that existing solutions are borderline pathetic. All you need to do is hop into their Discord to see the desperation for answers amongst this highly motivated and sophisticated community of self-taught hair researchers. Even the most cited hair loss researcher in the world said he was intimidated by the level of knowledge of the hair DAO community. It is no surprise to see their community thriving and on track to make genuine hair loss products that work. They need your help to do it. It is a pleasure to introduce you to hair DAO.
We're all born with great hair, and some people get to keep it. For the rest of us, there's Hair Wow, an easy application once a day, as painless as brushing your teeth. You'll say Hair Wow every time you... Yeah, a silver bullet for hair loss doesn't exist. They tell us it's not a disease. We're sold snake oil and told we don't need better solutions. Scientific research is stagnant, underfunded, and the patients have no agency. Get over it, they say. It's just hair. Well, we won't get over it. We think people deserve better. Hair DAO is a beacon of hope for hair loss sufferers and researchers alike. We're breaking the shackles of bureaucracy and cope to reduce the cost of research, free information from paywalls, and accelerate new treatments to market. But we need your help. Hair DAO is recruiting visionary researchers, affected patients, and crypto degens alike. We're building an army of people who won't accept the status quo. We're putting an end to hair loss for good, and we want you to help us cut through the bullshit and grow some hair. Visit hairdao.xyz to join the movement.
All right. Thank you, Benji, so much for that really kind introduction. Hope you guys liked our hype video. My name is Andrew.
I'm also Andrew.
And we're the co-founders of Hair DAO. So let me start by sharing my screen. Can you guys see that? Okay. So Hair DAO, network state solving hair loss. To start, let's focus on our large, impatient patient community, the section we also call Why Hair DAO. So Andrew and I have actually known each other since high school, where he was the unfortunate sufferer of diffuse thinning. Unfortunately, me and the other kids in high school were cruel, and we took to calling him Patches, which I found really funny. That is until the next year, my first year at college, when I started waking up with clumps of hair on my pillow. It was at that point that I realized how profound hair loss could be. Not only do things happen, as simple as girls liking you less or something kind of funny like that, but it's also more profound where for me, it was really the first time I came face to face with my own aging and my own mortality. And that was a really scary feeling. So I think, as you can see in some of the screenshots we pulled here, most of our community members feel the same. I think people are very quick to brush off hair loss as a trivial cosmetic issue. But it's really deeper than that for many. Knowing what a profound and stress-inducing experience hair loss can be, Andrew and I decided to start Hair DAO. The idea was to foster a community of like-minded individuals, those that were unhappy with their present situation and willing to do something to change it. I think Hair DAO has an important role to play because when you look at hair loss in particular, there are three main challenges that the community faces. 1, lack of innovation. 2, lack of public investment. And 3, a lack of private investment. We'll dig in a bit more to those points in a second, but for now, let's go to the next slide. Regardless of the challenges I just mentioned, the hair loss community is resilient. If you close one door, we'll open another. As a replacement for the total lack of traditional researchers, hair loss has developed one of the largest, most dedicated, most sophisticated online communities. That includes people analyzing the literature to find new gene targets, but it also actually includes people testing new non-FDA approved treatments on themselves. There's a really intense biohacker community in hair loss that I think often goes underappreciated or unnoticed. But I think it shows, honestly, the passion and the desire people have to cure this condition. Now onto the dismal state of modern hair loss research. This section will kind of dig more into the three main challenges that the hair loss community faces. So the first is just the current solutions are terrible. We have minoxidil discovered by accident in the 1950s while it was being used to cure hypertension. It's just really not very effective for most, despite what you might see in various marketing campaigns. Then you have finasteride discovered also by accident while it was being used to treat enlarged prostates in the 1970s. The side effects, it's a little bit more effective than minoxidil. The side effects are so bad, they actually have their own name, post-finasteride syndrome. So that should tell you all you need to know. That's a big risk just to take for your hair loss. People risk things like infertility. And then finally, you have hair transplants, which I actually got one because I was a candidate because I had primarily recession sort of on my temples. Backs is a diffuse thinner, not even a candidate. You lose density within 4 years, which I'm experiencing now. And they're also just really expensive. So not accessible to the overwhelming majority of the hair loss community. The next challenge that we suffer from, and I think it's the most interesting and most relevant for Hair DAO, is that because the NIH, who funds the overwhelming amount of early stage biomedical research in general, has decided to classify androgenic alopecia as a cosmetic condition, because they've decided to classify it as a cosmetic condition, effectively nobody funds it. And I think I like to quote Dr. Ralph Paus, we work with here all the time on this topic. And he says, if you suffer from something, it's the disease. And so who is the NIH to tell this massive online community who's clearly deeply affected by their hair loss, what is and isn't a disease? I think the last thing to touch on here is that the hair loss is represented by the National Institute of Arthritis and Musculoskeletal and Skin Diseases. I think you could imagine how capital allocation goes when an arthritis specialist is trying to allocate capital to early stage hair loss research. It's just not very efficient. Then we have the private market capital flows to just touch on here. You have 61% of the current market is hair transplants. The market in total is $7 billion, which I think says something, given how bad the current solution set is, that the market's that big. People are willing to pay even for bad solutions. The thing that sticks out most with me here is that the distributors like Keeps, Hims, Row, they spend about 110 to 120% of their revenue on marketing while spending 0% on R&D, which would actually benefit their market and their customers. But unfortunately, innovation is not the most short-term profitable business model, although we believe it's the most value accretive long-term. And so they've opted to really not spend any of their quite meaningful profits on R&D. The result of all of this is that we just have a really bleak startup landscape. There's no real companies to hold your breath for in the space. And that's where we come in, HairDAO. So with that, I'll turn it over to Baxt.
Yeah, thanks, Andrew. So if the first half is why HairDAO, then the second half is how HairDAO. Yeah, so our primary mission obviously is to solve hair loss. And there are really two ways we think we can do it simultaneously if we do it correctly. So the first is to empower both traditional and internet native researchers to discover new targets and ultimately new treatments. And the second is to grow the pool of researchers. So if we can convert more patients into researchers by providing patients tools to become researchers, and not necessarily, not everyone will become essentially a self-taught biologist, but even through just providing data and helpful information for the DAO, we think we can essentially grow the number of hair loss researchers significantly. And so the result, if we're successful, is a decentralized, vertically integrated pharma company that we think will be orders of magnitude more efficient than the current system. Looking at the current system today, fundamentally, there are two parties you really care about. They're the creators who create early stage IP, and then they're the patients who consume it. And then in between is a bunch of middlemen who take very high fees and really drive the patient and the researcher extremely far apart. So the first is universities are also tech transfer offices, and that's where research is created. And then the best research made at universities will be published in the best journals. The best published research will then advance to clinical trials. And then from there, the best drugs will advance to distribution, ultimately to the patient. Our job is to push the cost of all these middlemen to zero. This slide provides some more detail on how we're going to do that, but you can just read that later if you'd like. Sorry, next slide. So what we view our goal is to essentially remove all these middlemen. So instead of patients, researchers, hundreds of middlemen in between, we think it can just be patients, researchers, HairDAO, except we're not even separating the patient and the researcher because they're actually both a part of HairDAO. So there are really no middlemen. It's a very circular economy that we think we've already demonstrated can be self-sustaining and ultimately lead to significantly more efficient, better research than what's going on in the current system, which isn't really a low bar, but we think we can improve it by orders of magnitude and meet a high bar. So what have we done so far to disrupt these people? So the first one, we execute our first IP NFT. The number one critique we get as a DAO is, oh, you're just going to get the worst deal flow because you're going to get the people that can't get funding from traditional people. But no one wants to fund early stage hair loss research. So we think we actually have a really good piece of IP here, but we'll find out over the coming months just how good it really is. We also have really strong community growth, over 1,200 Discord and Twitter members. If you look at our Discord community as well, I think you'll find that our engagement per user is extremely high. In tandem with that, we've grown a really strong media arm through our own podcast with Ralph as a co-host, and then also through essentially a monthly overview of the research and operations of the DAO, which our community of active participants both creates with us and we think really enjoys. And then lastly, in tandem with all those three, is we think probably the best hair loss deal flow in the world. Between what we get from the traditional world and what we get from our community, we don't think anyone else has the same level of what's going on in the space as what we do. And so when we're thinking about products, we really separate into two buckets. There's R&D and then there's tools. So just going through some of the R&D highlights just really quickly. So we have the study with Ralph that we funded. We have one more study with Ralph listed here, but we actually have two more that aren't listed here that Ralph's proposed. Then we have some of the best equity deals. So Samson Therapeutics is the most well-funded or one of the most well-funded US hair loss startups. And then lastly is an example of a community-generated idea by an anon on our Discord. And then on the tooling side, so we spent a lot of time on the patient portal so far. The goal of the patient portal is to give hair loss patients anywhere with internet access the ability to contribute to HairDAO and without providing capital, so far just by providing data. And with that data allowing us to generate new research targets, place them in clinical trials, and ultimately, as we build a big enough data set, recommend treatments of what's currently offered today. We also have haircuts, what we've talked about before, some more media, and then we're right now currently building a research portal and in some early discussions about some other things we want to launch. Yeah, and so with the pipeline and the roadmap going forward, we really think about this flywheel on the right really all the time. It might sound like we have 4 separate businesses, but really all of them are to just continue to grow this flywheel. We think the faster we grow this flywheel, the faster we form a big enough moat where we win. So as our IP portfolio improves, we'll attract more members. From those members, maybe 5% are really strong early stage researchers. That will enable us to generate new targets, analyze old targets and IP better, develop an even better IP portfolio, which will attract more members, et cetera. Really all the tools, all the media, everything we do is to try to grow this flywheel, to try to empower each person that's participating in it, and ultimately to own the best hair loss IP in the world. Yeah, so that's HairDAO. We want you to join the Hair Force.
Yes, we'd love you to join the Hair Force. The easiest way to join our mission, hop in the community and be a part of the conversation would be to get into our Discord. If you'd like to buy the hair token, you can do so on Uniswap. And then if you're interested in a larger OTC transaction, the easiest way to do that, which we are open for now officially, the easiest way to do that would be to hop in our Discord and message me at averbs123 or Baxt at Andy1, or you could just DM us on Twitter or something like that. Yeah, with that said, thank you so much for listening to our presentation. Look forward to seeing you in our Discord Q&A after this. And Benji, with that, sending it back to Benji.
Thanks a ton, guys. I'm feeling hairier already. Next up, we have SciDAO, a group of psychedelics enthusiasts looking to bring greater interest, appreciation, and understanding to a field of research that is just beginning to wake up from a 4-decade-long hibernation. Though there are many startups and now mature biotech companies making significant headway in the drug development pipeline of psychedelics, SciDAO is taking a non-traditional approach with a bottom-up IP generation strategy. I can't imagine anyone better than Chris Burns, a prolific and innovative IP attorney, to present to you this awesome mission. There's a great quote that psychedelics will do for psychiatry what the microscope did for biology. Please welcome SciDAO.
Thank you, Benji. It's such an honor to be able to present today. My name is Chris Burns. I'm a registered patent attorney, a Web3 IP legal advisor, and a core team member of SciDAO. In my patent and IP licensing practice, I do so at Calyx Law, a preeminent IP boutique in the psychedelics market. I'm also a member of the Chacruna Council for the Protection of Sacred Plants and an active member in the Psychedelic Bar Association, where I focus on innovative means for intellectual property commoning. In my Web3 work, I advise Molecule, bio.xyz, and several other BioDAOs, including VitaDAO. I'm delighted to present to you today SciDAO, the most exciting DAO that I've worked with yet. Today, I'll be discussing the market opportunity and SciDAO's vision and mission in the market, our research pipeline, our exciting development of a new Web3-enabled IP Commons, an overview of our rapidly growing SciDAO community, and a preview of our next steps in launching the DAO. An ongoing mental health crisis is the key driver in really the new developments in psychedelic science. Mental health issues affect over 1 billion people globally and cost the global economy up to $16 trillion. This crisis creates an urgent need for innovation. Existing mental health therapies are inadequate. People living with treatment-resistant depression, addiction, PTSD, anxiety, eating disorders, all are in need of new types of therapies that can help patients address and integrate the traumas that underlie these disorders. Enter psychedelics. Psychedelics promise to massively disrupt this market, to offer new approaches to mental health treatment that have been resoundingly successful in studies to date. And in 2022, over $500 million was invested in psychedelic research, pouncing on regulatory shifts towards decriminalization and with an eye towards a $240 billion global market for mental health treatments. Beyond mental health, psychedelics are being studied to understand things like cognitive longevity and deeper understandings of human consciousness. Indeed, just like a microscope is used to study the cell, or a telescope to study the far reaches of outer space, psychedelics are tools. They can unlock a better understanding of ourselves and a better understanding of our own creative potential. SciDAO offers a new and unprecedented platform to connect community to psychedelic science, to make psychedelics accessible to everyone. As a community, we have over 3,500 members. As a Center for Psychedelic Science, we have over 10 research projects in our pipeline, including from psychedelic luminaries like Robin Carhart Harris and many more. SciDAO weaves community and science together like a mycelial network, connecting researchers, patients, medicine keepers, psychonauts, and entrepreneurs, all together co-creating the future of psychedelics. We do this by funding cutting-edge psychedelic science, converting the intellectual property that arises from the research we fund into tokenized research assets in the form of intellectual property NFTs. Through tokenized IP, we empower our community to co-create and co-govern the commercial ethics of our research and to create new opportunities for citizen science and the curation and elevation of psychedelic culture. We integrate all of this into a mycelial-like distribution network of data, rights, goods, and services. Our novel community-driven approach is in high demand. In fact, it naturally breeds interest and excitement from psychedelic pioneers like Professor Robin Carhart Harris, who hardly needs an introduction. Professor Carhart Harris helped to launch the psychedelic renaissance with his groundbreaking work with psilocybin and LSD nearly 15 years ago. He was the first scientist to administer LSD to humans in nearly 40 years following the advent of the Prohibitionist era in the early 1970s. We are in current and near final discussions with Professor Carhart Harris to fund a new project that uses fMRI, MMBS, and experience sampling to create a real-time model of valence-specific substates during MDMA-induced altered states of consciousness. The ultimate goal of such work is to improve real-time interventions in the emerging field of psychedelic-assisted therapy. But SciDAO is not only about funding the giants in the field. One of our key differentiators is that we can develop, harvest, and fund research that arises from our very own community. Additional research projects in our pipeline include those from Pedro Pena, a Brazilian researcher and active member of the SciDAO deal flow team. His work, through his company Naiad, uses AI to explore chemical spaces in the 5-H2A receptor landscape. We're also exploring a project with Malin Uthag, studying the effects of 5-MeO-DMT on stress and inflammatory immune functions. A third project, the Psychedelic Commons, builds on work that we've already begun. While I'll share further detail in a moment on the exciting work we've done with IP commoning to date, our pipeline aims to further develop our commons with projects that arise from the SciDAO community itself. This includes a citizen science psychedelic survey engine proposed by Balazs Szigeti and the collection of psychedelic session data with Sarah Honeycutt, both of whom are members of our community. Intellectual property commoning is especially important in the psychedelics market. Over the past 2 years, leading journals and publications from MAPS to Chacruna have been publishing thought pieces on how intellectual property commoning can help to solve growing concerns over the unethical development of intellectual property and race to the bottom competition in the ongoing mainstreaming of psychedelic science. Entities across the psychedelics market, including public benefit corporations like Tactogen, have been asking for the vision of a psychedelic ethical IP commons to be realized. SciDAO is rising to that occasion. Our very first community proposal was to launch an entheogen commons. We are now working with partners to sequence genomes of understudied psilocybe mushrooms and to correlate those genomes with experience data collected in our own community. Utilizing new token standards created by Molecule, we empower our community to co-govern the commercial ethics upon which an open access commons will otherwise be made available to the broader psychedelics community. Beyond research funding, SciDAO also administers Alchemist grants. Alchemist grants are modest grants of $100 to $2,000 to fund researchers, artists, and creators in the SciDAO community. Our first Alchemist grant went to Guy William Fincham from the University of Sussex, investigating the impact of breathwork on mental health. Our second went to Joseph Latore, a PhD candidate in psychology at the University of Ottawa, researching the experience of psychedelic use in individuals with a history of psychotic events. Our community engagement demonstrates the success of our market thesis. With over 1,500 Discord members, over 5,000 monthly visits, and over 4,000 Twitter followers, SciDAO ranks among the most popular early-stage BioDAOs in the market. We've received over 170 contributor applications, and our first community proposal, that for the entheogen commons, received 62 responses. And the momentum for our work has only continued to grow. At ETH Denver earlier this year, SciDAO members distributed 50 proof of trip packets, which we used to collect data for our entheogen commons. The packet included one psilocybe mushroom and a QR code for users to complete a mystical experience questionnaire. Our next steps in launching SciDAO are to sell membership NFTs to fund our initial Lighthouse project with Professor Cohort Harris. We are minting 1,000 unique NFTs of fMRI images of the brain during the psychedelic experience, combined with artistic metadata overlays. Our goal is to raise between $300,000 and $1 million doing this, and we have early indicators of support from key opinion leaders in the market. We, of course, invite all of you to participate. If you would like to learn more about SciDAO, please feel free to reach out to join the Q&A that we'll be having immediately after this session. And we encourage you, or promptly after the rest of our presentations today. We encourage you to check out our webpage at scidao.io, to join our Discord with the QR code link here, which will also take you to the Q&A page. And I really want everyone to be ready for our amazing community video that we will be launching immediately at the conclusion of Demo Day. One of the best pieces I've seen and a true testament to how SciDAO community has already been inspired to create new things. We'll be sharing all of those across our socials. Thank you so much for your time and interest in SciDAO. And thank you again, Benji, and I'll hand it back to you.
Thanks for that mind-altering presentation, Chris. Next up is Kai, who will present to you probably the most ambitious mission of anyone, to freeze time by freezing ourselves, not to mention thawing at a later date. When it comes to challenges worth solving, I don't know any more important than delaying death, and hope you'll enjoy me in applauding the incredible work of CryoDAO.
Alrighty, thank you, Benji. Appreciate you all for having us. I'm going to be introducing CryoDAO. My name is Kai Mills. I am the founder of CryoPets. I'm also a Teal Fellow this year, and of course now working on CryoDAO. I'm just one piece of it. There's a lot of amazing people that came together to make this happen. So we're going to jump right into it and go ahead and share this. So CryoDAO is a decentralized organization funding and incubating high impact research in cryopreservation, of course. Before we jump into all of the cryopreservation, I want to go ahead and define exactly what we mean when we say cryopreservation. I'm specifically talking about whole body cryopreservation here, or at least cryopreservation of the brain. Now, the goal with this is to keep people in a form of what we call cryostasis. essentially using very, very low temperatures and specialized cryoprotectants to keep them in stasis until medical technology advances far enough to not only bring them back from that cryostasis, but also repair the causes of death that led them to have to be cryopreserved in the first place. So why is this important? Why do we care about doing this? Because we're dying. Because everyone we care about is dying, everyone we love is dying, and this is unacceptable. And there is a solution for it, so we should be trying to push that solution forward. As long as there are causes of death that are threatening us, we need a way to be able to put biology on pause. And for the second and third points here, they really coincide because this is a field that is incredibly underfunded. It's something that has sort of been on the fringe for a very long time. It's something that hasn't had a lot of attention. Which is very bizarre because it is practically the only technology that can really directly target the problem of death. If we can place people in cryostasis, if we can put biology on pause, then regardless of what's wrong with them, we can go ahead and fix that at a later point in time. And we will be able to fix those problems at a later point in time. And because of this, once we accomplish that, cryopreservation truly can save more lives than any other single technology. And that's why I believe not only that it's very important, but I think it's the single most important technology that we can focus on over the next decade. And I think it's an incredibly big secret because not a lot of people are aware of the impact that it can have. So let's talk about the state of the science for a little bit. Where are we? What can we do right now? These are three of my favorite papers over the past, since the early 2000s up to now. These are probably the ones that I would hold on the highest regard. The first one here was a rabbit kidney that was cryopreserved, recovered, and then retransplanted into a rabbit, and that rabbit lived on perfectly healthy, and the kidney was functional, and it showed that we can actually cryopreserve and retransplant mammalian organs, especially ones that are as important as the kidney, of course. So that was just a really, really big moment for cryopreservation back around 2009. The second paper here is also incredibly important because when we're bringing people back from cryopreservation, of course, we want them to be in the same state that they were in the first place, right? We want people to have the memories that they had before, the personality. We want them to be who they were. So this paper was interesting because it essentially showed that we can cryopreserve C. elegans after training them. When we bring them back, they remember their training. So essentially proves that their long-term memory is still intact after the full cryopreservation and recovery process. In fact, in this paper, they cryopreserved pregnant C. elegans and were able to recover them, and they were able to give birth, and everything was perfectly fine there. So just a really, really cool proof of concept of retaining long-term memory through cryopreservation. And then aldehyde stabilized cryopreservation, of course, around the same time in 2015, where McIntyre was able to essentially very uniformly preserve the entire brain, right? And this was important because it shows that not only can we keep the long-term memory of the brain, not only can that persist after cryopreservation, but also if we can cryopreserve the entire structure of the brain, then essentially we're getting the whole process there from A to Z, right? So what are we working on? What are we starting with? First, we have a project from Ramon Risco, one of our scientific advisors, actually, and it's likely the first project that we're going to get started the fastest. And what we're working on is basically taking thousands of ultrasound transfusers and very uniformly rewarming large organs, human organs. And the long-term goal here is to actually do it with brains. And then the second research project that we're getting going with Ashton DeWolf is a combination medication, which we essentially apply to the patient prior to the cryopreservation process. And this allows us to just have a much higher quality cryopreservation. And right now it's not really something that's standardized across facilities. So it's important work to make sure that it's a very uniform way to actually begin the cryopreservation process. We've also gotten a lot of deal flow over the past couple months. A lot of researchers reaching out who want to get involved in this field. Cryobiologists who have been in the field for decades as well as a lot of people jumping over from longevity who want to start working in cryopreservation. So these are just some of the few that may be upcoming that I'm super excited about. The first one here, Persevelation, they actually had a lot of success with pig hearts back around 2014, I believe, fully cryopreserving and then recovering pig hearts, which are very, very similar to human hearts. And they did this by perfusing the organ with helium, which not only allowed them to cool the organ down much faster using less cryoprotectant, but it also allowed them to avoid a lot of the thermal stress that comes with going down to those temperatures. So really exciting work there. That's one that I'm very excited about launching in the future. And then we also have some work being done from Laura Jenks and actually Greg Fahey, who invented or basically introduced vitrification to the field of cryopreservation back in the 80s, I believe. Their goal here is to essentially do what we did previously with C. elegans, but start to do that with mice. So be able to cryopreserve and recover a mouse brain and show that what was learned prior is still persisting through cryopreservation. So there's a lot of work to be done. Those are just some exciting products that we're launching and things that we're getting going, but there is no shortage of things to work on in this field or for funders to fund in this field. There's an overwhelming amount of opportunity. This field is somewhat of a secret, and there's not a lot of people who are really working on this. So we definitely need a lot of these problems to be done, and this is just a snippet. This is what we could fit in one slide at a text size that is legible, right? This is there's so much more, and we definitely need a lot of help to make it happen. So essentially, how it works is we take the DAO. And through all these members in the DAO, we go ahead and vet and fund new cryopreservation research projects. This turns into IP that is generated, it's monetized, goes into proceeds, and then these proceeds go ahead and go back into the DAO. So that's the general flywheel of how this keeps moving forward, how we keep getting more funds to fund new research projects and launch very exciting work. So we put together a really strong core team. Emil and I, of course, run our own cryonics facilities. We also have Vincent and Lawrence from BioDAO, Nathan from Longevity Biotech Fellowship, which I know many of you are familiar with. Rebecca, who works at Tomorrow Biostasis as a perfusionist, product manager, and then Allison from Foresight Institute. Max Marty runs a lot of the community stuff in the cryopreservation field. So just a really strong team of people who have come together, and we're still looking for more people to not only join our core team, but also just join the deal flow team so they can review projects and help us sort of push this work forward. We also have our scientific advisors, some of which are launching these first research projects with us, who are also going to be helping us vet these projects and move them forward. And then we do have strategic partnerships around the world with different cryobiology labs, cryonic facilities, bio.xyz, of course, and BioDAO and some others. So yeah, we are officially launching today. This is where it all starts. You're more than welcome to scan the QR code, join our Discord. Following this, we're going to be having a 2-hour-long Q&A session. So please stop by and ask whatever questions you want. We'll be there, happy to answer. And yeah, thanks so much for having us here. And I'll throw it back to you, Benji.
Thanks so much, Kai. That was a really nice presentation. We'll try freeze this moment before we called it a day. Sorry, that's all GPT could come up with. Well, thank you everyone very much for tuning in. A few very brief and important things before we break here for Q&A. First, Cohort 2 applications are now open. If you have an idea for a biotech DAO or already have a community within a specific patient group or an area of biomedical research, we would love to build with you. And please scan the QR code for more details. Finally, we have a special surprise too for those who are viewing this live on YouTube. For the next 10 minutes, you can claim the bio.xyz Demo Day POAP. If you look at the live chat right now on YouTube, you'll see the details on how to claim it. Basically, if you type in !bio in the live chat and follow the link, continue logging in with YouTube and you'll be able to claim the POAP. After that, come back here to the live stream and scan the QR codes, which will take you to the Discord servers of each of the DAOs. We'll leave them up, so feel free to jump around. Thanks again for tuning in and joining us, and we hope to see you again soon.